Hi students, good morning to all. Today I am going to discuss about urinary tract infections. The urinary system is responsible for providing the route for drainage of urine formed by the kidneys, and they should be fully functional because their damage could easily affect other body systems. The normal urinary tract is sterile above the urethra. Urinary tract infections are caused by pathogenic microorganisms in the urinary tract. Urinary tract infections are the infections which involves the upper and lower urinary tract and can be uncomplicated and complicated. That is depends upon the patient's conditions. When it affects the lower urinary tract system, then it is known as cystitis. That is a bladder infection. When it affects the upper urinary tract, it is known as pyelonephritis. That is kidney infection. It includes kidney also. Definition: a urinary tract infection is an infection which involves kidneys, ureters, bladder, and urethra. These are the structures that passes urine through before being eliminated from the body. So it involves kidney, ureters, bladder, and urethra. The incidence, if you see, it is the second most common infection in the body. UTI is 50 times more common in women, which about 5% per year in the which causes symptoms among the women. It is uncommon in men below 60 years of age, but there is frequency similar in men and women in older age. The urinary tract is the most common site of infection, accounting for greater than 40% of the total number of reported cases in the hospitals. Causes are Escherichia coli. It is 80% of the urinary tract infection occurs due to the Escherichia coli. Enterococcus, Klebsiella, Enterobacter, Proteus, Pseudomonas, Staphylococcus, and Candida albicans. These are the other causative organisms for UTI. Then the risk factors: inability or failure to empty the bladder completely. So this will cause stasis of urine inside in the urinary tract, which attracts the bacteria into the system. So people those are having any conditions, so they cannot able to empty the bladder completely. So due to the incompletion empty of the bladder, so this causes retention of urine, that is stasis of urine, which helps to bacterial growth. The next is instrumentation of the urinary tract, that is catheterization or cystoscopic procedures may introduce bladder infection. Then obstructed urinary flow. Abnormalities in the structure of the urinary tract could obstruct the flow of urine and result in inability to empty the bladder. Any abnormalities in the form of congenital or other ways, then this may cause obstruction of urinary pathway. Then decreased natural host defenses. If the patient is in immunosuppressive tract or inability of the body to produce adequate amount of antigen antibody reactions, then the patient may develop a urinary tract infection. Then classification, it is based on the location and other factors. We can classify as 4 ways, that is lower urinary tract infection. This is due to bacterial cystitis, prostatitis, and urethritis, which may lead to lower UTIs. Then upper urinary tract infections are less common occurs. It includes acute and chronic pyelonephritis, interstitial nephritis, and renal nephritis. These are the causes which will lead to upper urinary tract infection. Then uncomplicated lower or upper UTIs. These are most commonly occurred through community acquired and are common in young women, but not usually recurrent in the form. So especially it is a acquired infections. Then complicated lower or upper UTIs. Complicated UTIs is usually occur in people with urological abnormalities or recent catheterization and often occur during hospitalization. So the causes are urological abnormalities, any urinary abnormalities, or if the patient may undergo catheterization or due to acquired infections. Pathophysiology: due to the entry of bacteria, infection occurs first as the bacteria gains access inside the urinary tract system. So this causes multiplication of the bacteria, that is bacteria attached to the epithelium of the urinary tract and colonize it. So this causes antigen production in our body, that is called the defense mechanism, or then evaded by the host. So this will lead to antigen antibody reactions, which may lead to inflammation. This causes by urinary tract infection by osmosis. The clinical manifestations: the patient may have a strong persistent urge to urinate, that is feeling of urgency. Then while passing the urine, the baby will have a complaint of burning sensation, and frequency, the patient voids more than the usual, that is every 3 hours once, and the quantity will be very less. Urine appears cloudy in nature. Then nocturia, the patient will be awaken at the night to urinate. It is also one of the signs for urinary tract infection, and the child will have a complaint of suprapubic or pelvic pain. Then urgency, there is also feeling that the patient would not be able to contain the urge anymore and would rush just to excrete it. Only less quantity will be there, but the child will feel bladder is full and they want void immediately. There is a thing, urge to excrete it. Diagnostic evaluation: urine culture. This is useful in identifying the organism present and the definitive diagnostic test for urinary tract infections. And if the child is adolescent and have a sexually transmitted disease, then we have to go for a STD test. Has to be performed because there are UTIs are transmitted sexually also. Then CT scan to detect the pyelonephritis or any abscesses present or not. Then ultrasonography. This helps to detect the obstruction, abscess, tumors or cysts present in the urinary system or not. Then voiding cystoerythrogram. This is an X-ray of the bladder and urethra will be taken. A contrast dye will be injected into the urethra, which will pass through the bladder. So through that we can come to know any obstruction is there or not. Then cystoscopy, visualization of the bladder to detect the structural abnormalities, any interstitial cystitis or masses is there or not. For that we have to go for a cystoscopy. And next is an intravenous pyelogram. This is the X-ray of the kidney. So here also contrast material injected into the vein and eliminated by the kidneys. In this, dye will be passed through the urinary tract and reveals any obstructions or abnormalities in the kidney or not. Management. So pharmacological management. If it is uncomplicated cases, we have to administer single dose of antibacterial and short course with followed by 3 to 4 days regimens or 7 to 10 days regimen according to the patient condition. The most commonest drug is cephalosporin combination or ciprofloxacin can be used. Then complicated cases, cephalosporin or ampicillin, otherwise aminoglycoside combination can be given for 7 to 10 days. The ciprofloxacin is often used as a first-line drug because the Escherichia coli has developed resistance to ampicillin. Then trimethoprim or sulfanomethoxazole. These are the other commonly used medications to treat complicated urinary tract infections. The other drug of choice is levofloxacin, that is group of fluoroquine. It is a good choice for short-term therapy for uncomplicated cases, that is mild to moderate urinary tract infections. Then for long-term pharmacological therapy, That is, if the patient is having recurrence. If infection reoccurs after completion of one course of antimicrobial therapy, then we have to start with another course of short-term therapy, that is 3 to 4 days of full dose antimicrobial therapy has to be prescribed for the child. Then after treatment of short-term therapy and sterilization of urine has to be taken to see the urinary culture. Then we have to provide a low dose of preventive therapy, that is trimethoprim with or without sulfonylurea. Each night at bedtime is oftenly prescribed as a preventive therapy. Then nursing assessment. So history has to be collected for signs and symptoms related to urinary tract infection. That is whether the child is having a suprapubic pain or burning sensation, urgency to void. So these all the history has to be collected from the mother or from the patient. Then we have to assess the patient knowledge about the prescribed antibacterial medications and preventive healthcare aspect also. Coming to the nursing diagnosis, the first one is acute pain related to infection within urinary tract as manifested by pain or on urination, suprapubic pain or bladder spasms. So intervention, assess the onset, duration and level of pain, provide comfortable position to the child, reassure and provide diversional therapy according to the age, then psychological support, alert patient that benzopyridine will change the will causes orange color urine. So that education has to be given to the parents as well as to the child to avoid stress or doubt. Then apply heating pad to painful area to reduce the pain level. Then provide analgesics. Then second diagnosis is impaired urinary elimination related to urinary tract infection as manifested by urgency, frequency, incontinence or hematuria, as well as the interventions are assess the changes in the usual voiding pattern, instruct patient regarding the reasons for symptoms, encourage the child to take more amount of fluid or administer IV fluids, then obtain urine sample for cultural sensitivity, administer antimicrobial medications for the patient, instruct patients about good personal hygienic care and cleansing after each bowel and bladder movement. Tell the patient to observe the urine for color, odor, amount and frequency. Then third is hypothermia related to infection as manifested by elevation of temperature, tachycardia, chills and malaise. So assess the vital signs every 2 to 4 hours. Administer antipyretics and antibiotics to the child. Ensure the hydration either via oral route or by IV fluids. Monitor intake and output chart. Cover the person and keep him dry. Provide cooling sponge baths or compresses to reduce the temperature. Then risk for reinfection related to lack of knowledge. So regarding measure to prevent recurrence, the interventions are assess the signs and symptoms of infection, explain the importance of taking the antibiotics. Symptoms will improve after 1 or 2 days of therapy, but organisms may still present in the urine. So that explanation has to be given to the parents as well as to the child to ensure that they have continued the antimicrobial therapy as a full course. Then instruct the patient on appropriate hygienic care, which includes careful cleansing of the perineal region, wiping from front to back after urinating, cleansing with the soap and water after each bowel movement, emptying the bladder before and after intercourse. Then instruct the patient to urinate whenever they have urge. Occurs at least 2 to 4 hours during the daytime. Instruct the patient about the need to maintain adequate fluid intake. Advise the patient to report symptoms or signs of any recurrence of urinary tract infections. Then deficient knowledge related to lack of information regarding predisposing factors and prevention of disease. So the nurse should encourage the patient to drink liberal amounts of fluids and promote renal flow and to flush bacteria from the urinary tract. So encourage the patient to frequently void, that is every 2 to 3 hours, to empty their bladder completely, because this is the one of the reason if stasis occurs, that will be promote the bacterial growth. So we have to ask them to empty the bladder every 2 to 3 hours. Then irritants, that is avoid any irritants such as coffee, tea, Coca-Colas and alcohols which may cause urinary irritants to the child. That has to be avoided. And preventive measures. So we have to provide a proper education to the parents as well as to the child. Do not delay in urination when it is necessary. Then fluid intake. It is essential. We can advise to go for a cranberry juice daily, that is 250 to 500 ml. Then clean the perineum and urethral meatus from front to back to reduce the concentration of pathogens at the urethral opening. Encourage them to go for a shower bath than the tub baths. Then often long courses of low dose of antibiotics at the night time, which helps to prevent the urinary tract infections as well as unexplained cases of recurring urinary tract infection, especially bladder infection. Then avoid urinary tract irritants such as coffee, tea, Coca-Colas, alcohols, other things. Then voiding habit has to be improvised, that is every 2 to 3 hours in the daytime. Advise the child to void it. These are the education has to be provided to the parents as well as to the child. Thank you. I hope you all will understand this topic.